In this lecture, we look at pain and the way we can treat it pharmacologically. Pain is the fifth vital sign. Analgesia is the inability to feel pain. An analgesic induces analgesia. Pain threshold is a representation of the amount of stimulus needed to elicit a pain sensation. Pain tolerance, however, refers to pain one can endure or handle before it interferes with everyday functions. Let's look at the gate control theory.
Wow, sweetheart, you really fell hard getting that last ball. Are you okay?
Yeah, Aunt Lori. I am fine. Actually, it did not hurt at all. I wonder why that is.
Oh, that's probably because your neurological gate was closed.
My what? Was what?
Your neurological gate. According to the gate control theory, your spinal cord may either block pain signals or allow them to pass on to your brain. When the gate is open.
Hold on. There's a gate inside of me? Like a fence? Who told you there was a gate inside of me?
No, sweetheart. It isn't the large gate you're thinking of, but its job is very similar. This gate control theory says that the gate decides which pain we feel and which goes unnoticed. Ron Milzak and Patrick Wallen came up with this theory many years ago, back in the 1960s.
I think I get it. So, there is something in my back that didn't let me feel the pain when I fell down.
Right. According to the gate control theory, we can be distracted from the pain by the release of endorphins. The hype from the game may have released these feel-good neurotransmitters.
Well, what if that didn't work? Is there anything I can do to control this gate on my own?
Of course. The neurological gate may be closed via massage, acupuncture, or electronical stimulation. Your spinal cord has small nerve fibers and larger nerve fibers. The small ones activate and open the neural gate to turn pain on. The larger ones, when stimulated, close the pain gate to shut pain off. Massaging, doing acupuncture, or trying out electronical stimulation are all things that create activity in the larger fibers to shut your pain off.
Wow, that is a lot of information, Aunt Lori. Hey, thanks for letting me know all of those things about closing up my neural gate and everything.
You're very welcome, kiddo.
Oh man, now that the adrenaline rush has died down some, I think my gate is opening. My back hurts. Can I get an ambulance over here? Hello?
Remember what I told you about stimulating your large nerve fibers.
Pain comes in many different types. And sometimes it's acute, chronic, sometimes it's caused by cancer, sometimes it can be somatic or superficial, vascular or visceral. So pain comes in many types. Pain is thought to be undertreated. There are some non-opioid analgesics. So these are things like NSAIDs, and there are some non-NSAID, non-opioid analgesic. So aspirin, ibuprofen, naproxen or naproxen, those are NSAIDs. And then there's acetaminophen, which sits in a class all by itself. How does pain work if we're treating it?
Say you're at the beach and you get sand in your eyes. How do you know the sand is there? You obviously can't see it, but if you're a normal, healthy human, you can feel it. That sensation of extreme discomfort, also known as pain. Now, pain makes you do something. In this case, rinse your eyes until the sand is gone. And how do you know the sand is gone? Exactly, because there's no more pain. There are people who don't feel pain. Now, that might sound cool, but it's not. If you can't feel pain, you could get hurt, or even hurt yourself, and never know it. Pain is your body's early warning system. It protects you from the world around you and from yourself. As we grow, we install pain detectors in most areas of our body. These detectors are specialized nerve cells called nociceptors that stretch from your spinal cord to your skin, your muscles, your joints, your teeth, and some of your internal organs. Just like all nerve cells, they conduct electrical signals, sending information from wherever they're located back to your brain. But unlike other nerve cells, nociceptors only fire if something happens that could cause or is causing damage. So, gently touch the tip of a needle. You'll feel the metal, and those are your regular nerve cells, but you won't feel any pain. Now, the harder you push against the needle, the closer you get to the nociceptor threshold. Push hard enough, and you'll cross that threshold and the nociceptors fire, telling your body to stop doing whatever you're doing. But the pain threshold isn't set in stone. Certain chemicals can tune nociceptors, lowering their threshold for pain. Now, when cells are damaged, they and other nearby cells start producing these tuning chemicals like crazy, lowering the nociceptor's threshold to the point where just touch can cause pain. And this is where over-the-counter painkillers come in. Aspirin and ibuprofen block production of one class of these tuning chemicals, called prostaglandins. Let's take a look at how they do that. When cells are damaged, they release a chemical called arachidonic acid. Now, two enzymes called COX-1 and COX-2 convert this arachidonic acid into prostaglandin H2, which is then converted into a bunch of other chemicals that do a bunch of things, including raise your body temperature, cause inflammation, and lower the pain threshold. Now, all enzymes have an active site. That's the place in the enzyme where the reaction happens. The active sites of COX-1 and COX-2 fit arachidonic acid very cozily. As you can see, there's no room to spare. Now, it's in this active site that aspirin and ibuprofen do their work. So they work differently. Aspirin acts like a spine from a porcupine. It enters the active site and then breaks off, leaving half of itself in there, totally blocking that channel and making it impossible for the arachidonic acid to fit. This permanently deactivates COX-1 and COX-2. Ibuprofen, on the other hand, enters the active site but doesn't break apart or change the enzyme. COX-1 and COX-2 are free to spit it out again, but for the time that ibuprofen is in there, the enzyme can't bind arachidonic acid and can't do its normal chemistry. But how do aspirin and ibuprofen know where the pain is? Well, they don't. Once the drugs are in your bloodstream, they're carried throughout your body, and they go to painful areas just the same as normal ones. So that's how aspirin and ibuprofen work. But there are other dimensions to pain. Neuropathic pain, for example, is pain caused by damage to our nervous system itself. There doesn't need to be any sort of outside stimulus. And scientists are discovering that the brain controls how we respond to pain signals. For example, how much pain you feel can depend on whether you're paying attention to the pain or even your mood. So pain is an area of active research. If we can understand it better, maybe we can help people manage it better.